My name is Dr. Camilla Jones. I've just attended a study committee for a single-payer health care program and presented in front of the legislature of the state of New Hampshire for consideration as a member of the New Hampshire Medical Society Single-Payer Interest Group and the New Hampshire Granite State Physicians for a National Health Program. I'm interested in studying the issue of health care in the state of New Hampshire and looking for a better way to provide health care to our patients who are suffering because of lack of insurance, lack of ability to pay, and postponing health care because of financial reasons or lack of health insurance. The U.S. spends more than any other country on health care. There's a little graph on the second page that will show you where we stand as a nation compared to all the other nations. And we spend the most on health care of any nation. And that includes what we spend on with public funds and with private funds. So we have the most expensive health care system in the world. And yet we do not have the highest life expectancy in the world. We do not have the highest level of, we have the highest level of infant mortality. That we have more babies that die, and probably because of lack of prenatal care due to lack of insurance. The economic benefits to having a commission to study this would be that businesses would profit from not having to pay for health insurance for their employees. Under this system, they would be deducting an amount of money that they would pay for that, and it would be much less than the premiums for insurance. It would also mean that there are not various ways of paying for insurance. Depending upon the company, there would not be, there would be, in some cases, a lack of a choice of physician or lack of a provider in the insurance policies that people have. If someone leaves their job, they lose their insurance. And to pay for that insurance is much higher. Insurers can also sort of cherry pick which people they want to insure, and that is a problem that some people don't benefit from. The administrative costs of a system such as this would be that there would be less administrative costs from the insurance companies. A lot of our premiums go to the insurance company's administrative costs, which includes very high payments to chief executive officers and those are paid for by our premiums. The issue that came up with privately delivered, publicly financed, is that this system is not socialized medicine. Socialized medicine would be a system where the government pays for everything, for doctors' salaries, for hospitals, for any kind of health service. This system would not do that. This system would just be a way of accumulating funds to pay for health care for all of our citizens, so that everybody would be insured of having health care. The survey that was done in New Hampshire amongst New Hampshire physicians showed that 2/3 of the majority in the New Hampshire Medical Society, show that 60 to 70% of physicians in the state, the study was done through the New Hampshire Medical Society and the University of New Hampshire,
and found that most physicians would support a single payer type system. There are many other states right now that are within the Affordable Care Act looking to have waivers to provide their own funding of health care, as opposed to the multiple insurers that are currently available and the difficulty of having assurance of health care. We are proposing this study commission to consider all of these aspects of a Medicare for all type system, so that we could provide universal health care through public funding that would assure every citizen of this state health care. I have a few personal remarks that I want to make. As a physician, even though I'm retired, I've seen so many patients who have so many difficulties because of paying for health care. And most of these patients have some kind of insurance, but it just doesn't do it. A number of patients will not get health care because of the premiums, because of the deductibles and copays that they can't pay, so that they'll wait until they're very, very sick and then count on their insurance. They also forego care because of the cost to them. I met a man who would not receive cancer therapy because he didn't want to leave his wife with a mortgage on their house. I think it's so difficult for people to receive health care, to get severe illnesses that have piled up because they haven't had primary care, and so on. And I think our citizens deserve better than this. So that's why our group would like to request a study to see if it would be feasible in our state to provide health care to everyone with no copays, no deductibles, and work on getting healthier people because they're getting care and that we care about them.
Thank you very much. I think we get the gist of what you're trying to get into.
My question to you is that under the existing federal regulatory umbrella, is what you're suggesting even feasible?
I'm not sure. What I do know, though, is that Medicare, when I was overseeing insurance, reimbursement, billing for patients, there's maybe pros and cons. Medicare was what I call black and white. There are certain things that are covered, as you know. And you know that with Medicare going into it, what is covered, and if it's not covered, you know that up front. I found out with private, we call maybe private health insurance, it was a very gray area. The fees that the physicians charged, that we had to charge for people coming into our clinic, could have been reduced, in my opinion, by at least 30%, maybe more, if we had more guidance. I say guidance, but with private insurance, because I had 2 people for an office of 12 people. I had 2 people who just worked on insurance. And why? Because every insurance company, people would walk in, put their card down, and kind of say, well, is this going to be covered? I don't know. Let's find out. We would either have to throw it back to the patient, or we would have to do a lot of legwork, and when the bills were sent in for reimbursement, they would come back. Maybe they would be covered, maybe they wouldn't be covered. It's just, I'm taking kind of maybe more than you need. I'm into the weeds, but when you're in this, in hospitals and in large clinics, you go in there, you can see people in back rooms, they're all working, typing away. They're all trying to figure out how do their patients, you people, how are their bills going to get paid? It's very, very complicated. It seems, again, I'll repeat, there's got to be a better system here.